We'll see how this goes. All right, awesome. So we're live now. Hi everyone. This is the voice and the face of Dr. Tulu Labintong. I'm the CEO and co-founder of Living Spring Family Medical Center here in the beautiful city of Mansfield, Texas, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. If you're joining us live, please hashtag live. If you're joining us on replay, hashtag replay. As always, please invite guests, tag them on, forward this video to them. But I'm delighted to be having this conversation with you today and with a repeat guest, Dr. Malathi Acharya. Did I say that right?
Acharya. It's like a chair.
Acharya. I should have asked you that one. I was so amused by your first name. I didn't ask you your last name, how it's pronounced, but thank you so much for coming on here again. How are you doing, Doc? How are you doing?
Thank you for having me here again, Dr. Tolu. I'm doing great. Thank you for asking. I'm joining from the beautiful city of Fremont here in the Bay Area. It's a little cloudy today. I guess today we can't compete against your city.
And it's cold. It's cold. It's cold. It's cold. But Doc, I'm so happy
Yes.
to have you here. We're talking about pressure-free living, how to master blood pressure with lifestyle hacks. And I'm happy to have Dr. Malathi here. She's an integrative medicine physician, and she's the founder of Ayur Integrative Medicine. She's passionate about all elements of integrative medicine, including nutrition, lifestyle, supplements, botanicals, mind-body treatments, and treatment from alternate medical system. She's a big advocate of whole person care. I love what she does. She addresses the physical, the mental, the emotional, and the spiritual health. And she's here to spend time with us to have conversations to help improve quality of life when it comes to blood pressure and other things too. So, Doc, can you kindly, I already introduced you a little bit, but is there anything else you want our viewers to know as they listen? And then the second part of the question is, why do you do what you do?
Absolutely. I just, Dr. Tolu, you gave me a fantastic introduction. I just want to add one thing. I want to explain to our viewers what integrative medicine means. Um, um, Integrative medicine means that I pull in or integrate treatments from not only the Western system of medicine, but I pull in treatments as well as healing practices from other systems of medicine like the traditional Chinese medicine or the Ayurveda or naturopathy or sometimes homeopathy, along with complementary and alternate systems like manual treatments, osteopathic
Mm,
manipulation, things like that. So in integrative medicine, we pull in treatments for all of these systems. So basically, we have a lot of tools in the toolbox. So we are able to create a wholesome and personalized plan for for our clients or patients. And another thing another system we really rely a lot on is mind body treatments, which we are going to touch upon when we talk, a little bit later in this segment. So that's integrative medicine. Why do I do what I do? Um,
mhm.
I started off in the medical field being an internal medicine doctor. And for the first 10 years of my career, little over 10 years of my career, I worked as a hospitalist. And um, that means that I was in the hospital seeing patients who got admitted who are really sick, stabilizing them, getting them well, and getting them discharged to go home. That's what I did. Then I moved on to outpatient, where I started seeing patients in the clinic. So I was doing one perspective, and then I moved on to the other perspective. As I practiced in the outpatient medicine system, I started feeling two things. One was that the Western system of medicine, the allopathic system, which I've been trained in and I practiced,
Mhm.
is very skewed, meaning it's very disease oriented. For example, if patient complains of symptoms, if the symptoms or the blood test don't put that everything together into one disease, I often did not have anything to offer for the patient, right?
Mm,
So I found that, hey, and I felt like the focus on prevention, it was not that much. And I also felt that There were many of my patients who were healthy, meaning they didn't have any chronic medical conditions. Yet they wanted to know, what all can I do, doctor, to continue to stay healthy so I don't get any of these conditions. So I didn't have, yes, I would give the diet, do this, do that, the usual things, but I felt like I was not giving them much value. And my patients also would often ask me, doctor, what can we do naturally? Is there anything I can do? How can I change my diet in a space? Even for, symptoms like back pain, when I would take some ibuprofen, they would ask me, what can I do naturally? What is natural? And I would give them some answers, but I was not happy with those answers myself. So I started looking for, and I found this fellowship in integrative medicine at the Andrew Weil Center. And when I went through that specialized course, I felt like it gave me a lot of answers and a lot of tools that I can use to, you know, to kind of refill the deficiency that I had noticed
Mm,
in the other areas. So that's why I do what I do. I have a special focus on taking care of uh, patients diagnosed with cancer, because there is a big application for holistic or integrative treatments, in the life and journey of a person diagnosed with cancer, right from the time of diagnosis to after the treatment.
wow. I love that. I love what you do. And I too share some of the sentiments you had about the skewedness of allopathic medicine and the need for more balance and more lifestyle things and integrative medicine as a more of a wholesome approach. So I love that. So we're going to go to the meat of the matter, and we're talking about lifestyle tips on lower how to control or better control blood pressure. So how do lifestyle factors? Because sometimes people think high blood pressure means you're under a lot of pressure. Um, but let's talk lifestyle factors such as diet and exercise, and how do they contribute to maintaining a healthy blood pressure, doc?
Actually, if I have to say, I'm going to say that diet and lifestyle is everything, in maintaining a normal blood pressure and thereby maintaining us healthy, because blood pressure is key. If one has high blood pressure, that leads to heart problems, strokes, kidney problems, a lot of things. So lifestyle factors play a huge role in maintaining a healthy blood pressure.
Awesome, awesome. Now let's talk specifically though. Are there foods that people can add more into their diet to help manage or lower blood pressure? If so, what are those foods? What do you tend to recommend?
Absolutely. So the first thing I'm going to talk about when talking about food and high blood pressure is salt intake. By salt, I mean sodium intake. Okay, because there are other salts also, but the salt that's not good for us is the sodium salt. So high salt intake is related to high blood pressure. And conversely, reducing our salt intake
Hmm.
gets our blood pressure down and controls it better. Now, people, when we talk about salt, immediately then people ask, oh, when I cook my food, should I not add salt? Now, the food that you cook at home actually is a very nutritious thing, and the salt you add there is going to be very controlled. But here is the silent, risk that we are facing is the salt that's there already in the processed food that we consume. Anything you open out of a package or a can and consume, there is a lot of excessive salt, in fact, in those foods, and that is what harms us. So yes, we have to be very mindful of the salt we add when we cook the food, but we have to be even more mindful of the salt that we inadvertently consume when we eat packaged and processed food. So it's a good idea to always read the label and note the salt content. So the upper limit of salt intake is you know recommended intake is 2.3 grams or less. Moving on to specific foods, yes, absolutely. So eating a food, a variety of vegetables and fruits in all the color ranges plays
Hmm.
a great role in maintaining our blood pressure, because the vegetables contain a lot of micronutrients. plant nutrients that actually go inside our body and work on our heart and blood vessels and help, you know, reduce the tension in the blood vessels, helps dilate them, as we call it, and helps normalize the blood pressure. So variety of vegetables and fruits in all color ranges is one. Whole grains, whole grains with the bran, they have the micronutrients in addition to the carbohydrates and the proteins, and they help in reducing the blood pressure also. Nuts, nuts and seeds, again, really helpful in bringing down the blood pressure. Avoiding refined and processed food. If there is one take home point after this live show, it's this, that avoiding refined and processed food is one great way to control the blood pressure.
Now let's talk a little bit about processed food. Give examples of processed food, because people feel like bread is not quite processed, right?
It depends on the type of bread it is. Okay, so the definitions I have read about processed food, I still like the very first definition I came across in 1995 when I just moved to this country. Okay, so at that time, what I read was that if it's a food that you're able to open a package and eat, and that's all you need to do, you have to go to the store, buy it, open the package and eat it, that's processed. The more closer it's to these three steps, the more processed is the food. On the other hand, let's say we are going to eat salad, or we are going to cook and eat something. You go to the store, you buy the ingredients, then you come home, you wash them, you put them together, and you eat. So that is that's cooking. So eating, for example, in any meal, cooking the meal is not processed. Buying frozen meals and eating is processed. So that's the difference. The closer it is that you can open the package and consume it, that's processed. Now, remember, the one thing to distinguish is that sometimes vegetables and fruits are washed and packaged, and salads are also packaged, so there you can open and eat it. But that's not what I'm talking about. It's more of the prepared foods. Okay, and bread. You have a great point, Dr. Tolu. So it depends on the bread. Okay, there are some breads, and what is the bread made of? Is it refined grain or whole grain? That's what. But there are breads that are made in factories or big bakeries or wherever. They're packaged, and then they are transported across the country, and they get into the supermarket shelves. And if you look at the shelf life, they will last for 2 weeks, 3 weeks, or sometimes even a month. There are, when I wasn't much aware of this until, recently, I would say, until I went through the fellowship, or maybe it's slightly before that. And I have consumed a lot of these breads that have a long expiry date. So imagine if it's a food and it has a long expiry date, they have added chemicals to it to process it. So that bread is bad. But on the other hand, there are many shops where you can find freshly baked bread, freshly baked sourdough bread. It comes with an expiry date because they don't add any chemicals, and it's going to, any food undergoes degradation. That is not processed. So it really depends on the bread.
Thank you for expounding on that. Now, I have someone who asked this question who said that he's been told, someone told him that some bottled water like Aquafina has high sodium. Does that count? What would you say to that, Doc?
If it does, if the ingredients say, if you read the ingredients and it says sodium, yes, I would avoid that water. I have looked sometimes. I don't look at every bottle of water, but I've looked sometimes, and I know that it says zero on the usual bottle brands that I consume. But if that's a brand, if he has looked at it, and if they have looked at it and there is sodium content, I would avoid that. It should not have any salt content.
It's water. Okay.
Yeah, it should be just water and nothing else. 0 calories, zero everything.
All right. So we talked about the foods to add. Now let's talk.
I also want to take a minute and talk about one other thing. So
Yes,
while sodium increases blood pressure, foods containing potassium and magnesium, fruits, vegetables, nuts, the potassium and magnesium oppose the effect of sodium. So they work in bringing the blood pressure down and relaxing us. So consuming foods rich in potassium, magnesium, and calcium is another protective thing. And again, you don't have to remember all of these because we always go back into these group of healthy foods.
We can't go wrong with fresh fruits and veggies.
Exactly. Yes.
Ah, awesome, awesome. So, are there foods? So you said limiting processed foods. Let's talk activity. What activity, generally speaking, would you say is good to help normalize or lower or support blood pressure health?
I'm going to start by saying any activity is good. Okay. Any activity is good. That could involve starting at getting up. Some of us have a very sedentary work,
Mm.
work environment, work style, not lifestyle, home style. But at work, we tend to be sitting and talking a lot. So getting up and moving is the first step in movement. Getting up and taking a few steps several times a day, going out for a walk is movement that counts too. Okay, going out for, so, you don't have a long stretch of time, going out for 10-minute walks 2 times a day, that counts as movement too. And so does, heavier exercises using a machine like without a machine, like jogging or running or jogging, or, if you have a machine at home, elliptical, peloton, heavier, they also count. And so do really moderate to severe exertions like hiking. So the bottom line is any activity counts. Okay. And the higher the blood pressure is, the more it will respond to just exercise.
Mm.
And the more it will respond to exercise and bringing it down. And while you know it's directly proportional to the amount of exercise, I'm going to just say that start anywhere and you will be way ahead in no time.
Start anywhere. Get to moving. You
Start
heard me.
anywhere. 5 minutes of movement, 5 minutes of walking, 10 minutes of walking, and build slowly. All big changes happen in small steps.
All big changes happen in small
Happen
steps.
in small
Very
steps.
good. Very powerful. So start where you are. Start small. Just start. Um, Now let's talk about stress. Um, how does stress impact blood pressure, and what lifestyle strategies can help mitigate or reduce the effects, Doc?
Stress management is Stress contributes a lot to not only blood pressure but to several chronic conditions. Stress promotes inflammation in the body. Inflammation causes metabolic problems, heart disease, diabetes, and even cancer. So, stress management is a very, very important part of managing the blood pressure. And sometimes we don't recognize stress at all, but the key thing is this: we all are exposed to a lot of stress every day, and all of us should um, have practices that we go to that help reduce that level of stimulation. So when we are stressed, cortisol is secreted, our heart rate goes up, our blood pressure goes up, because stress means danger. So our body is preparing for us to escape from the danger. But those dangers are not there for us anymore. What was primitive in evolution, those dangers are not there for us anymore. But we don't know that. Our body doesn't know. So it prepares blood pressure, heart rate, ready to run. And we experience this even without realizing several times a day. So we have to have practices that help with stress management. They can be simple things like, breathing exercises, simple deep breathing exercises. They could be something like meditation.
Mm.
There could be something like other mindfulness practices like journaling, things, gratitude practice, things like that. They could be uh, there could be time in nature. That
Mm.
helps with stress management. It could be activities like yoga and tai chi. So mind body practices that slow you down and helps us focus on the breath, focus on the present, focus on the one movement we are focusing on. They're all stress management tools that help.
Mm. And we can incorporate this throughout the day. We don't have to wait till the end of the day to go and de-stress. We have to
And
incorporate because we spend a lot of time at work too. So really
yes,
important to
yes.
incorporate that.
And
All right.
2 minutes, 2 minutes of taking time to just sit down, and do a breathing exercise. And you can feel as you do the breathing exercise. So breath is the one thing we control our body, voluntary, the things that we control in our body, we control through our breath. Breath is both. It happens, you can control the breath, and it happens when you're not thinking also. So, but breath is what helps us control our heart rate and blood pressure. By slowing down one's breath, we can bring down the heart rate and bring down the blood pressure. And it's amazing. There is this method called biofeedback where I literally will put uh, it's a heart rate it's a blood pressure biofeedback method where I put the cuff on, measure the blood pressure, and have them, talk them through slowing down the breath and a specific breathing pattern, and we'll see, and then maintain in that slow breathing pattern and see the blood pressure come down. So it's amazing, and we can, these things don't take much of effort, much of time. Even 2 minutes, 3 minutes is good to begin with.
I like it. I like how easy it is. I mean, easy to do, easy not to do. But I hope people are taking note. These are things you can quickly incorporate. Won't cost you much. And I see that too. Even when patients come in to have their blood pressure checked, have them relax a little bit. Blood pressure is much better than if they were
Yes.
to come in hurried. All
Yeah.
right. Let's talk sleep. Is there any way sleep ties to blood pressure? How does sleep play in maintaining optimal blood pressure? And do you have any quick tips on how people can improve their sleep habits?
So sleep helps blood pressure in several ways. Okay, one is that sleep helps with stress management, and
Hmm?
managing the stress brings the blood pressure down. So that's one way sleep circles back to reducing the blood pressure. Sleep, we meditate, and when we meditate, we slow down our breath, we focus on on something. It can be our breath, it can be on a mantra, it can be on an image. We focus on something and we go into a different level of consciousness where we are recognizing our thoughts, but we are not focusing on anything. Now sleep is a much so when we meditate, we are controlling the sympathetic nervous system, which is a stress response, and we are elevating, or we are activating the parasympathetic, which is the rest and relax system. Now
Mm.
sleep is just a much deeper form of something similar. So sleep is a state where we go into a deep parasympathetic state. So it is literally 8 hours where your blood pressure and heart rate goes down, and that does dramatic things to what our life is going to be the
Got it.
next day, right?
Mm.
So
Got it.
it is, I mean, I cannot say this, insist on this any. I cannot downplay the importance of sleep in blood pressure control, stress management, helps us think better, function better, everything. And with respect to sleep, sleep hygiene is the most important thing. I would say consistent sleep habits, going to bed at the same time, waking up at the same time, and sleeping with what we call a circadian rhythm. So sleeping at the onset of darkness and waking up with light. That is also important because but sometimes when we have a skewed sleeping habit, and sometimes when we go to sleep at 1 o'clock or 2 a.m. in the morning after having fun, or being with friends or watching TV, and then we get up in the morning 8, 9 hours later. Yeah, technically we've gotten 9 hours of sleep, but that's not restful sleep. So
Mm.
sleeping with the circadian rhythm, cycle of darkness and waking up with light is also important. Physical activity helps with more healthier, and uh, for people who have difficulty falling asleep, exercise is a good way that helps you fall asleep easily. Also, what we eat and drink, we need to watch. Excessive caffeinated beverages do interfere with sleep. Stimulants like alcohol interfere with sleep. Eating a nutrient rich food actually helps us with our sleep. So eating, it's all tied together. Diet, lifestyle, sleep, stress management, it's all tied together.
It's all tied together. You said a lot, and I'm hoping that people are listening. Proper sleep hygiene is important for your blood pressure. We talked about healthy eating, a plant-rich diet is very, very important. Stress management also very, very important. And I love how you mentioned sleep as a form of meditation that helps relax your your
Yes.
whole body for 8 hours. So you want to get enough
Eight
of it.
hours. Yeah, yeah, absolutely. You want to get enough. It's easy.
Wow, wow. So I have someone who's watching, who's looking, who's like, oh, they're on blood pressure medicine. They feel a little frustrated. When they feel like, I don't know if I'm going to keep having to take this medicine, and I don't know about the lifestyle. I want to do something today that my blood pressure will snap back to normal tomorrow. What advice will you give to that person who is a little discouraged and who feels frustrated with the fact that they have high blood pressure? On how would you encourage them when it comes to this lifestyle piece? That usually is not as quick maybe as the blood pressure medicine, but they are open to trying it out because they want to adopt a heart healthy lifestyle. What would you say to encourage them, doc?
I would, again, my mantra is always small steps. So when we think of diet, um, make one or two changes a week. So introducing more vegetables and fruits in the diet could be something. Okay, so that could be the first step. Look, starting to eliminate the processed and refined foods that we eat. That could be the first big step. So pick one thing you know that you know in your heart is important, and start on that. So all big changes happen with small steps. And so someone patients, depending on how high the blood pressure is, we sometimes we have to start the blood pressure medications right away. Sometimes we can say, if they're mild hypertension, we can give a trial period where say, hey, try these diet and lifestyle measures and come back and we'll see. But sometimes when the blood pressure is high, because the goal is to prevent downward complications, so we start medications. But that is, all hope is not lost. That doesn't mean that one is going to be on the medication forever or needs a high dose of medications or whatever. So when we start on the medication, we also talk about diet and lifestyle changes. So if one starts incorporating this diet and lifestyle changes step by step in small increments, the blood pressure is going to come under better and better control. And working with the doctor, and I'm going to insist on this, working with the doctor, not without the knowledge of your primary care doctor, you can slowly work on adjusting the medication as you bring down the blood pressure by natural methods. So yes, sometimes we do want to start on blood pressure medications. Remember, the key thing is to prevent complications, so we want to do that. But all is not lost, all hope is not lost. So you can start with small changes and keep adding. As you keep adding to these small changes, boom, they're going to have big effects. And you working with your doctor, you can considerably reduce the dose or even get off the blood pressure medication. And yes, you have everything in your hands. You have complete control of this.
It's not all or none. So you're encouraged to partner with your doctor,
Yes.
incorporating
Yes.
lifestyle changes, taking the medicine. Who knows? You come off or get half of them,
Yes.
or not even need more. So it's
Yeah,
always
or
worth.
maybe a small dose of one medicine. I've seen so many patients who do that. But it's what I want to make sure everyone hears is, it's not sometimes, when we give the medication and it's a 1 month supply. Sometimes my patients used to think, okay, that's it, I will take it for 1 month and it's done. It's not like that. It's something. And I'm not saying that you have to take it forever, but it's something that you have to do jointly with your primary care doctor. Work together and in small steps, and you may be able to. I have had patients who were on two medications, who needed two medications to start with, on with high blood pressure. And when they started with these other measures and they really took it into their hands over the next 6 to 8 months, they actually have had patients who have gotten off
Yes,
medicines completely.
yes, it
But
is
it's a
possible.
joint effort with a lot of monitoring and continuation. But once, I will guarantee, once you start making these changes, and once you're going to, before even the numbers show, you're going to feel good by
Yes.
eating healthy food. You're going to feel good by moving. You're going to feel good by managing the stress. You're going to feel good by getting enough sleep. So that feel good is very addicting, right? So once you start and you give, these changes are something that you're going to do on a consistent basis. And, that becomes part of one's life, and that is going to maintain the blood pressure. So
Yes, you're encouraged. You heard it, Doc. That's awesome. Now, Doc, we're wrapping up. It's already 7 o'clock. I have people who are watching who are like, oh my goodness, I love her. I want to come, maybe interact with her or have her come speak on my platform. Doc, where can people find you?
you can find me at my website. It's www.ayur.today. I also have a Facebook account. It goes by my full name, Malathi Acharya. I have an Instagram handle. It's Dr. Malathi 2023. That's my Instagram handle. And you can also email me at drmalthi@ayur.today.
And I'm putting all her handles. Her website is down there. Her Facebook is on there as well. She's on LinkedIn too, and on the Instagram. So for those of
Yes.
you who are watching us live on Instagram, she's also on there too. So I'm putting that at the bottom of the screen, Doc. Thank you so much for taking time to come to empower us, to encourage our viewers on hacks, lifestyle, things that they control. And just so you know, those of you who are watching, the more you do this, the less you need to see us. Just saying. Just saying. So be encouraged. And she's even put her email address as well. So you could email her, follow her to get more useful information too that will help improve your quality and quantity of life. Doc, thank you so much for coming. I appreciate you taking the time out of your busy schedule to come engage with us today. I appreciate you.
Thank you for having me, Dr. Tolu. It's wonderful talking to your audience and talking to you.
And we'll do this again in probably a few months. Okay, deal?
For sure. Take care.
All right. Thank you all for watching. Those of you who watch live and in replay, I appreciate you. And as always, if you or anyone you know is looking for an awesome, a thorough, and a compassionate family physician in the Mansfield, Texas area who will have conversations like this to help you live long and well, I am she. And if you are looking for an integrative physician to help empower you, she's well rounded. And where are you? What state are you in again? Remind me because I want to put
California.
you. She's in
California.
California. Look her up. Partner with a good family physician, a good physician, a primary care doctor who will help you live a better quality and quantity of life, combining medicine and lifestyle changes and other forms of healings that are actually at your disposal. So there you have it, everyone. Have a good night, okay? Thanks again, Doc.
Thank you. Take care.